Whoa. It's okay. Okay. Whoa. Yeah.
And then crank it up even more. You have your own knee problem and you've got a little bit of
I have a valgus before me. I have tricompartmental disease. I had ACL with MCL laxity. I had it fixed back in the day when they didn't fix the MCL. So my laxity, so ACL laxity, MCL laxity, sorry, ACL tear, MCL laxity, both missed back. And so over the course of when I was 22, so it's been now 30 years, and I have bone on bone. The last 2 years, I lost 50 pounds. So now, because I need, so I'm active, but I can't do as much as I'd like to do. So I do low impact.
Okay. Congrats on the 50 pounds. That's great. And okay, so if you do an air squat right now, how much pain do you have? 1 through 10.
Right now, it's starting about 7.
7. And it's mostly on the lateral part or patellofemoral.
Patellofemoral.
Okay. So we're going to put you in a neutral patellofemoral motor. You've got pretty significant valgus. So this is going to kind of correct your valgus. And we would have to decide, our engineers would decide based on your pain level, lateral how much lateral limit you want to go. So have a seatbelt. So we're going to put your condyle right over the condyle. I usually put this strap on first, right over the belly of your calf.
Or someone who wears a suit all the time, you put it on top of the suit, or
I fortunately don't require this. So if I'm active, I wear it. I don't wear a suit. But we have you. Yes, you'd probably wear it over the suit because these are tetanus blasts. Okay, so it's just a little bit, get nice and so. Make it kind of snug. So, let me tighten this guy up. And it's not custom, this is our off the shelf. So go ahead and stand up. Yeah. It might feel a little weird, but go ahead and do actually, hold on a second here. Okay. So, go ahead and do a squat. Now, there's a little bit of tension, but not much. You feel a little assisted force. Now, go ahead and take that dial, rotate it. This one? This one right here. Okay. It only rotates one way down. And now do a squat here.
whoa.
It's okay.
Okay. Whoa. Yeah.
And then crank it up even more. So you can see.
This is incredible. Okay. So
Yeah.
let's get a custom one.
Okay, good. And so when you sit down, now you can push the button to release tension. There. So that's release tension. So to stand up, you have a lot of pain when you stand. You will crank up the tile, gather tension.
So is it a spring that's loaded?
Yeah, so what's happening is take this dial, it draws these elastomeric bands over the hinge into the frame.
Okay.
And so when you go into flexion, so when you tighten that, it's wanting to spring you back up. So it's like taking weight off. You just lost all this weight.
This
so
does
Brace
even
is
more
doing
than
that just on your knee.
Got it.
Subjecting your knee to less weight. So it's so it's kind of like a quad assist.